15th, we are going to have practical classes in the lab. Please make a few things very clear. Uh, in third year, you don't have to perform any practical uh, in the lab, not even in your exams. So there are no practicals in third year pathology in which you are going to practically do anything with your hands. There is nothing to form, there is no test that you are going to perform. In OSPEs and in practicals, we are going to discuss what is going to come in the exam and how it is going to come in the exam. So we have three or four, I have prepared 3 or 4 OSPEs, and these are the questions which are given in the OSPEs in the last 2 or 3 years. And this is exactly the same as the OSPE is presented in the examination, and this is how you are going to answer. Same way, when you are going to come on 15th, we are going to have uh, practicals in the lab, and the format of the practical is going to be that each day one batch, according to the roll numbers, they are going to come to the lab, and they are going to be here in the lab for 1.5 hour to 2 hours. I'm going to display all the pictures, all the specimens, and all the things related to microbiology in the lab, which is going to come in the OSPE or in your exam. And you are going to have 2 hours to patiently see all the things, ask questions. I will be there, and I'm going to answer your questions. uh, and these are going to be the things which are going to come in OSPE. Please make it very clear. Please don't ask irrelevant questions about OSPEs or practicals again and again to professor or HOD or principal or anybody. There are no practicals by hand in third year. Please make it very clear. So everything in the OSPE is going to be from what we have done in the lectures or in the tutorials. You are going to get pictures, and you are going to get questions related to those pictures. I will show you what kind of pictures we are going to give you in the exam. The specimens regarding journal pathology and microbiology, we are going to deal with them from 15 onwards till 28th September. So each batch or each group of roll numbers is going to come twice, and you are going to have 2 hours to see all the things in the lab, and I'm not going to take them off till 28th September. So you have enough time. You are going to have enough time to see them, and you may ask questions if you have any. Please come prepared with the questions. Please be come prepared with what you are going to see. Starting with today's OSPE, I'm going to show you how OSPE is presented in the exam and how you are going to answer. So today topic is parasitology. There are going to be 12 stations. 6 are from journal pathology and 6 are from microbiology. And this distribution is that you are going to have one station from cell injury, one station from inflammation, one station from healing, repair, and amyloidosis, one from genetics, one from hemodynamics, and one from neoplasia. So these are 6 stations regarding journal pathology. In microbiology, you are going to have one station of parasitology, one station of immunology and virology, one station of mycology, one station of culture media, one station of biochemical test regarding bacteria, and one station is going to be from bacteriology. You may get some picture of a bacteria or some presentation of a patient, so you are going to answer those questions. So most of the time we are giving pictures, the specimens and all the things which are given, you are going to see on 15th. So parasitology. So let's start. I have written some questions and I'm going to answer those. So this is station number one. This is how a station comes in your OSPE. In your OSPE, you have 4 minutes for each station. You have got 4 marks for each station, and you may get 4 questions on each station, 1 mark each, or 3 questions with different marks, or 2 questions with different marks. So the maximum questions you can have on one station are 4 marks, 4 minutes, and 12 stations. So you don't have to perform anything. You are not going to have any viva on these 12 stations. Apart from these stations, let me make it clear before we start with the OSPE. You are going to have 4 more stations, which are actually observed stations. On those stations, you are going to have a viva. In those stations, you have one station is from stool examination, that is going to deal with the parasitology. So stool examination is actually a viva from your parasitology. uh, each station, each observed station is going to have 6 marks, and you're going to have a small viva on that. One station is stool examination, and that is actually parasitology. Another station is urine examination. You don't have to actually examine the urine or examine the stool. You're just going to have a viva. In case of stool examination, you are going to be asked to draw 1 or 2 ovas or cysts from a parasitic infection. And in cases of urine examination, you are going to be asked to draw abnormal things you can see in an abnormal urine, like RBCs, like crystals. So I'm going to tell you from where you have to go through all this. Then you are going to have one station regarding biochemical tests in bacteriology. You don't have to perform those tests. You are just going to be asked to write the interpretation or the result of any of the tests. For example, like urease test, you are going to be asked that write down the result of a urease test, how the urease test is going to be called, positive or negative, and give some examples. Then you are going to have a small viva on that. And the fourth station is going to be about staining. You are only required to know 2 stainings in third year, that is ZN Z Nelson staining for acid fast bacilli, and gram staining for gram positive and negative bacteria. You are going to be asked to write down the procedure for staining, or the result if the slide is stained, or what is the principle of gram or Zn staining. You are not going to perform the staining yourself. It is just that you're going to write down all these questions which are asked, and then you are going to have a small viva for each of these 4 stations. And these 4 stations are compulsory for all, and these are the 4 stations which are going to come daily in OSPE. So one is gram and Zn staining, one is biochemical tests from bacteriology, one is urine examination, and other is stool examination. And the other 12, they are unobserved stations without any viva or any practical thing. So let's start with the unobserved station. Station number one is identify the life cycle and name the parasite. So you may get a life cycle in a picture, and you are going to write down just the relevant answer. Please make it very clear. Don't write long sentences. If you are asked the name, write only the name. And as you know that the name is going to be what is written in the key. So actually that is not that something else is written in the key. That is that if the name is written in the key and you are writing the same name, you are going to get full marks. So spellings are very important. Full name is very important in cases of bacteria or viruses or fungi or the parasites. So please only don't waste time, only write the relevant answer. Identify the life cycle and name the parasite. So if this question is of 1 mark, you are going to get full mark if you write the name of the parasite. So the parasite is uh, sorry, I cannot ask you questions, so I have to go by myself. This is pinworm, and you can see a D-shaped egg. So this is Entrobius vermicularis. Describe the ovum of this helminth. Please, again, make it very clear. Read the question carefully first. The first question was identify and name. You only have to write the name. The next is describe the ovum. So you have to write down that it is a D-shaped ovum with a thin eggshell and a larva in the center. This is a small sentenced description. Name a common test used for the detection of its ova. So you just have to name. So it is a scotch tape test or a cellophane tape test. You are going to apply a cellophane tape or a scotch tape in the perineal region, and you are going to just put that tape on the slide and view the ova underneath the uh, objective lens of the microscope, and you can diagnose that this is Entrobius vermicularis. So this is how you're going to go through the station. So if I say question number one has got 1 mark, question number two has got 2 marks, and question number three is going to carry 1 mark. Describe and name the stool sample. Describe means that you at least have to write a sentence. So this is a melanic stool. This is melena. Describe the stool is that this stool is black, tar like, greasy, and sticky. So a foul smelling, sticky, tar like black stools and unformed stools. So they are semi liquid stools. So this is a melanic stool or a melena. So you may write melena or melanic stool, and you are going to describe it in a sentence. Enlist causes of this type of stool. So number one cause is upper GI bleeding. So upper GI bleeding means bleeding from the lower part of the esophagus, from the stomach, or from the duodenum and or jejunum. So not more than that. Mostly it is from the lower part of the esophagus or from the stomach. So upper GIT is stomach, lower part of esophagus, duodenum, and jejunum. So if you have bleeding from these areas and the bleeding is such that the patient is not vomiting the contents of the stomach, you may get blood in the stool, but it is going to be black because when the blood is going through the entire GIT, it is going to get degenerated and broken down, and the color of the blood is going to change like this. The blood and the blood products, they are just mixed with the contents of the stool. If you have a stool in which you have blood mixed with stool, that means that the blood is coming from the small intestine or ileum. It may be brown in color with red tinge. If you have blood streaks or if you have blood clots in the stool may be normal in color, and you have separate blood streaks or blood clots, that is the blood is coming from the colon or the rectum till the sigmoid. If you have fresh blood in stool, which is separate from the stool contents, the blood is coming from the anal region. So, looking at the stool and looking at the color and the consistency of the stool and the blood related to the stool, you may judge that from where the bleeding is and from where the blood is coming from. So, this tarry, black, sticky, foul smelling stool, unformed, is from the upper GI bleed. The next question is give causes of steatorrhea. Steatorrhea is a bulky, white colored, foul smelling stool which floats on water. So, if you see stool, it may be floating in the toilet, and the stool is bulky, stool is white or off-white in color. That is because of the increased fat contents in stool, and the causes of steatorrhea is that when fat is not properly metabolized. So you may have pancreatic insufficiency, you may have gallstones. The patient may be a patient of gallstones. You may have increased fat diet, the patient may be obese. So, some of the causes may be related to the indigestion of fat and increased fat coming in the stool, which is not absorbed or which is not digested. So, these are some of the causes of steatorrhea. One thing about the black stools, if the stool is formed, it is properly formed, but it is black, not tarry black, but black. That is that the diagnosis for that stool is that the patient is taking IV iron therapy or iron tablets for a long period of time. So the metabolites of iron can turn the stool black. Whenever the therapy is withdrawn, the stool is going to change into normal color. But the stool is formed in that situation. And if the patient comes with such a type of stool, you may just counsel the patient that it is one of the side effects of the drug which you are taking, that may be iron therapy. And whenever you are going to withdraw the therapy, you are going to get normal. Describe the parasitic form in the blood film. So this is a blood film. You can see RBCs in the background, and these are the parasites. You are going to first describe that this is a blood picture showing RBCs in the background. You have a parasitic form which is banana shaped or which is sickle shaped with chromatin content in the center. It is not present inside the RBCs. Name the parasite. You are going to write down Plasmodium falciparum, because Plasmodium falciparum, the gametocytes of Plasmodium falciparum are going to show this shape, and they are diagnosed on the peripheral blood film. So, describing the parasites is that it is banana shaped or elongated gametocyte form of a plasmodium, and marks will be given if you are going to write Plasmodium falciparum, because there are four types of plasmodia. The other three are not going to show you this type of gametocytes. They are rounded or oval. Only the falciparum is going to show you the banana shaped uh, gametocyte. Name the parasite: Plasmodium falciparum, and list complications of this parasitic infection. Complications are cerebral malaria. Complications are excessive splenomegaly. Another complication is black water fever. Complication means presentation which is not directly related to the first symptoms, signs, or presentation of the disease. That is because of the mismanagement of the disease or prolongation of the disease. So complications are if the disease is not properly managed or not properly treated. So in this case, the parasitic infection is a blood-borne infection from a bite of a mosquito, and it is a blood infection. But the complications can be cerebral malaria, and that again, falciparum is one of the culprit falciparum species, and black water fever again, falciparum plasmodium is the culprit, and then excessive spleen may be one of the complications. So if you write even the two main complications, you're going to get full marks. So name the protozoa and draw its cyst form. So this is the trophozoite form of a protozoan. So you know that you have two forms in a protozoa, a vegetative form and a cyst form. In cases of worms, you don't have cyst; they lay eggs or ova. So make it very clear that whenever you are talking about a cyst, it is that you are dealing with a protozoa. Um, in case of parasites, you call cyst, but you don't call cyst in case of bacteria. There we have spores. There are no cysts in the bacteria. There are no cysts in the viruses or fungi. So cyst is just for the protozoa. So in case of worms or helminths, even you don't have cysts, you have ovas. So name the protozoa. This is Giardia lamblia. You are going to get mark if you write this full name, and draw its cyst form, because the picture shows a vegetative form. You are just going to draw a cyst form with the pen with which you are writing the OSPE. You don't have to color it. You don't have to make it with a pencil or uh, any artistic form of the cyst. The cyst must show that you know that how the cyst of Giardia lamblia looks like. So you're going to have a thick cystic wall with four nuclei, and that is all. Name two hemoflagellates. Hemo means blood, flagellates means parasites having flagella. So again, worms cannot go into the uh, bloodstream. There are some worms which can go into the blood. We are going to deal with those in the later slides. Name two hemoflagellates. So those parasites having flagella. So one of them is leishmania, and other is, sorry, there was something. Okay, so sorry. So name two hemoflagellates. That is, one is leishmania. Leishmania, one of the forms of leishmanias, is flagellated. So it has got flagella, and other is Trichomonas. Sorry, Trichomonas is a genitourinary flagellate. Trichomonas vaginalis is again a flagellated. protozoa, and it has got flagella just like giardia. So giardia is a gastrointestinal flagellate. Trachomonas vaginalis is a genitourinary flagellate, and Leishmania is a hemoflagellate. Sorry, I cannot recall the other. I'm going to just give you the name in a few minutes. So this is how you are going to get the OSPE regarding protozoa. So you are mostly going to get a vegetative form, which is clear. You're not going to get a cyst form. Mostly it is asked to you are asked to draw a cyst in the OSPE, but a vegetative form which is clear, and which is going to clearly show you which parasite it is. In case of Trichomonas vaginalis, Trichomonas has got one nuclei, and Giardia has got two nuclei. Uh, and there are four pair of flagella in case of giardia, and in case of Trichomonas vaginalis you have um, an undulating membrane, and both are pear shaped. So this is how you can get another life cycle. All the life cycles are there in Levinson, and you are going to get life cycle in which you are going to have the form of the parasite, ova if it is a worm. You are going to have the intermediate hosts, and you are going to have a site of infection, so you can clearly identify which parasite it is. So identify the helminth and its class. Helminth is, it is Diphyllobothrium alatum, and the class is cestode. Cestodes are tapeworms. Nematodes are roundworms, and trematodes are flukes. So you have three classes in helminths. You have nematode, you have cestodes, and you have trematodes. So you are just going to write Diphyllobothrium latum, and you are going to write down the uh, class, that is cestode. What is the cause of anemia in this helminthic infection? You are just going to write the name, that is vitamin B12 deficiency anemia. Name another parasite which causes infection in humans by taking infected raw fish. And other is Clonorchus sinensis. So Diphyllobothrium latum is one, which is going to have a host, which is a fish, and if the person is taking in undercooked or raw fish, he or she may get the infection. The other is a fluke, that is Clonorchus sinensis, and that may cause a liver disease, that is from class trematodes. So here is another thing related to stool examination, another thing related to parasitology. Name the item and give its uses. The item is, it is a cotton wool swab. It is the same swab by which we take samples from the nose, from the throat, from the oral cavity, from the ear, from the conjunctiva, from the skin ulcer or a skin wound. And this is the same swab we can have samples from the anal canal or rectum. So if the person is not defecating, if there is no stool, but the patient is having symptoms of infection in the rectum or the colon, you may take rectal swab. So the swab is going to contain the bacteria or the microorganism. You can get them cultured or get them stained with gram staining and see under the microscope and diagnose. So this is done only when the patient is not passing stool. So identify the item. You're going to just write down the name and you're going to write some of the uses. So define tenesmus and dysphagia. Dysphagia is painful defecation. So it is pain during defecation. So dysphagia and tenesmus is uh, uneventful straining at stools. Uneventful means that a person is having an urge to pass stool. He goes to the toilet and sit there for a long period of time and strain, but there is no stool content. That is tenesmus. So, uneventful, long or prolonged straining at stool without having a stool is called tenesmus. That is because you have an infection in the rectum or the anal canal or the colon, but there is no stool contents. That infection or inflammation is causing the defecation reflex. What is the common transport media for a stool sample? So transport media is a chemical which is used in bacteriology to transport a sample. That is that when you are going to transport a sample which is going to reach the lab longer than 4 hours. If it is going to take longer than 4 hours, you are not going to send the sample without a transport media. The best sample is an immediate sample. So either the sample is taken in the lab or it is immediately transported to the lab. But if you have a delay of 4 hours, to transport that sample to the lab, you have certain transport medias. Every specimen has got a specific transport media. For stool, it is Carry Blair media, Carry Blair Carry Blair media. So Carry Blair media is a uh, transport media for any types of stool sample. But in case if you are suspecting cholera, it is transported in alkaline peptone water, because Vibrio cholera cannot stay without an alkaline environment. So clinically, if a good history is going to show you that the patient is having cholera, the stool sample is sent in alkaline peptone water. But the question here is, what is the common transport media for stool sample? You just have to write Carry Blair transport media. This is one of the universal medias for any type of stool sample other than cholera. So this is a vector uh, of one of the protozoa. So looking at this vector, uh, this is an insect or a bug. A vector is uh, an insect. A vector is an organism which is related to or which is part of arthropod group only. So a vector is an insect or an organism related to an arthropod group which carries a bacteria or a virus or a parasite or a fungal spore from one place to the humans or inject them into the humans. Vector is only an insect or an arthropod, which is just transporting the microorganism. So the word vector here means that you are dealing with an arthropod. So this is a vector. You can see the stool also, that the patient, sorry, the vector is going to defecate on the skin. So give two names of this vector. This is ridwood bug. Another common slang name is a kissing bug. It is called a kissing bug because it mostly bite near the lips. It is going to defecate after sucking the blood from the skin, and that stool from the bug is going to contain the parasitic species. So, which parasite is transmitted through this vector? That is trypanosoma. So, trypanosoma has got certain species. So, Trypanosoma cruzi is the only species which is transmitted through this redwood bug. Trypanosoma cruzi. Name the disease caused by this parasite, that is sleeping sickness. So the bug is redwood bug or the kissing bug. The parasite is Trypanosoma cruzi. If you write trypanosoma, you may get half mark. You have to write trypanosoma cruzi. Name the disease, that is sleeping sickness. The other forms of sorry, I'm really sorry. Name the disease, that is Chagas disease. The sleeping sickness is caused by the other two species of this parasite. Those are Trypanosoma gibbonsi and Trypanosoma rodentii. So the sleeping sickness is caused by those other two species. This Trypanosoma cruzi is going to cause Chagas disease, or the other pronunciation is Chagas disease. So Chagas disease is that it is going to present with uh, enlargement of the heart. It is going to present with megacolon, two important organs which are going to get enlarged. One is colon and other is the heart. So Chagas disease, redwood bug or kissing bug, and Trypanosoma cruzi. All the trypanosomas are flagellate, and all the trypanosomas are blood-borne infections. So the other hemoflagellate was trypanosoma. So two flagellates or hemoflagellates are leishmania or trypanosoma. In this case, um, the Trypanosoma cruzi is causing Chagas disease. Trypanosoma rodentii and Trypanosoma gibbonsi, they are causing sleeping sickness. Trypanosoma cruzi is mostly prevalent in South America and or the Latin America, and the other two, they are prevalent in Africa. Describe the ovum and the parasite. So this is an oval ovum with a thin shell, and you have a small hooklet on the lateral side of this. Uh, so this is cystosoma. Cystosoma is a trematode. It is a fluke. Cystosoma has got three species: Cystosoma japonicum, Cystosoma hematobium, and Cystosoma mansoni. Cystosoma hematobium causes infection in the urinary bladder. Cystosoma japonicum causes infection in the colon, and Cystosoma mansoni causes infection in the colon and the hepatobiliary system. So, Cystosoma hematobium have got a similar egg, but the hook or the hooklet is at the terminal pole of the ovum, while in this case you have a lateral hooklet, And in case of Mansoni, you have a small rudimentary hooklet on the top of the ovum on the lateral side. So this is cystosoma, egg of or ovum of cystosoma japonicum. So name other two parasites of this group, that is cystosoma hematobium and cystosoma mansoni. Name a lung fluke, that is Paragonimus westermani. Paragonimus westermani is a lung fluke, and you are going to get this. You may get this infection by eating raw crab, and this is one fluke or a parasite causing infection in the lung directly. And the sample that is going to show you the eggs of Paragonymous festamini is a sputum sample. Uh, Eggs of or ovum of Cystosoma japonicum or mansoni can be seen in the stool, while the eggs or ovum of Cystosoma hematobium can be seen in the urine. So another question that name some ovas which you can see in the urine sample. Number one is cystosoma hematobium, or that is the only one. If you see eggs of any other parasites, for example, Enterobius vermicularis or Ascaris, that is not coming from the urinary bladder. That is a contamination from the stool. The only egg of a parasite that can come directly from the urinary bladder into the urine is cystosoma hematobium. Surgical specimen from a patient is shown. How this patient would have presented to the hospital. So this is a specimen of an intestine with a lot and lot of round worms, and you can see a portion of a stool also. So these are round worms. The most common worm infestation is Ascaris lumbricoides or Ascariasis. This is Ascaris lumbricoides. You have got a lot of worms in the intestine. So this is a surgical specimen. Sometimes if the patient presents with obstruction, you have to resect that portion of the small intestine. So how this patient would have presented in the hospital, that is with intestinal obstruction. Name the parasite,
Sir,
that is
sorry to interrupt you.
Ascaris.
Just 3 minutes left.
Okay. So name the parasite, that is Ascaris lumbricoides, and its class is nematode. So it is a helminth and it is a nematode. What is Loeffler syndrome? Loeffler syndrome is eosinophilic pneumonitis or eosinophilic pneumonia. So it is that when the larvae they are traveling through the alveoli or the lungs, the larva of Ascaris and Enterobius, Ascaris and Ankylosoma duodenale, they may cause eosinophilic pneumonitis, and that is called a Loeffler syndrome. So name this protozoa. This is a blood film. You have a slender or a banana shaped protozoa, and you have a flagella on its end. So this is leishmania. So leishmania, name the vector causing this infection in the human. The vector is sand fly. So trypanosoma is caused by tsetse fly, and leishmania is caused by sand fly. Name two hemoflagellates, leishmania and trypanosoma. So sandfly is called sandfly because of its color only. So the color of the fly is light brown. So it is not because of that it lives in deserts or it's seen in desert. It is just because of the color of the fly. So this was all about parasitology. You may get similar types of questions. I try to